Yes, yes, it is. Hello, everybody. I guess we're going to be doing my FME install today. I'm quite excited. I've needed this work for a long time. Once upon a time, I did numb myself up in the mirror and just kind of pulled one of those stock MSEs out of the box. This was like a couple years ago. Um, and put it in together, with one of my assistants. It was just freehand, so it wasn't really meant to kind of carry any expansion or anything. Had it in there for a few days, but kind of gave me really the purpose of that exercise was to understand some of what it felt like to kind of do some of the work that we often do. And so it was a humbling experience. Of course, this is going to be a bit more robust. That was just 4 screws, no bone cuts or anything. This is going to be 10 screws and a bone cut. But yeah, I have a pretty large cohort of the symptoms that I often treat people for, and I just hope that what I mean. This will give me more perspective on how to better help people with these problems. And I've learned, of course, living a very busy life, treating these issues. I've kind of learned the importance of mental strength through these kinds of things. Of course, for me to be able to perform and show up to work, sometimes 7 days a week, it requires some deal of mental fortitude. I, encourage that really as a primary focus for a lot of the patients that seek this kind of treatment. This treatment is not, I think, it's not lightweight work. We're doing work in the skull and the cranium, trying to fix, structural and functional issues. I do believe that there's, a big role of, kind of stress reduction and, anxiety response kind of stuff. And again, I know that everybody's, the way that people deal with those things is very different, maybe different from the way I deal with it. But I know that it's been very valuable to me to have, maybe some stress management in my life to deal with some of, my physical issues. But I'm very excited because, I feel like, in addition to some of the obvious benefits of breathing better and having a little more space and airway and all that, I hope that this will be part of a wellness snowball for me. It's been a long time since I've really paid attention to myself, so I'm hoping that this will, also be a step in the right direction for me. Maybe some small improvements will then motivate me to, kind of, maybe formulate some more routine with nutrition, fitness, other things like that. Many of you who've known me for a long time know that I look a little different than I did 10 years ago. I'm hoping that today kind of marks, the beginning of a reversal of that trend, and I'm hoping that with a little bit better breathing, oxygenation, you know, endocrine metabolic profile, has a better opportunity to improve. Very much looking forward to that, and just yeah, journey to better health in general. And again, I might be, I think I'm gonna tend to be a bit more ambitious with my amount of expansion. I feel like I could use a lot, and so we'll see kind of what happens. I mean, we definitely know of the different tricks in the playbook to try to make you know pretty expanded jaw work together in a bite. So I'm not gonna be shy. I think with my procedure, of course, with I'm 37 years old, so I kind of fall in that category where you know where I can't necessarily sit here and know exactly how predictably this is going to go, but we think that with the bone cut and with pretty robust 10 screw FME, our results are suggesting that this should be successful. Of course, I'm looking forward to it, but I don't fear failure, and I hope to project some strength for my future patients and current patients. That again, as long as you have a helping hand by your side, navigating through challenges and failures is okay, and so anyhow, that's, I guess without further ado, let's hop into the chair, get
Of
started.
course, yes.
Yes, sir. And you can see if people have preliminary questions and stuff.
Mm-hmm.
You know what I'm saying?
Right now, everyone's super excited.
Okay, cool. Because I could probably, before I sort of am less capacitated to answer questions, any early questions that people have for me based on my sort of monologue there, I'll be happy to answer for a few minutes before we sort of dive in.
All right. I'll be reading the questions.
All right.
Please ask any questions.
Yeah, you can.
Why don't you bring the live up on your phone and you can see people answering the questions?
Oh, yeah, I have.
So you don't have to like break your back.
Or you can also put it up on the TV.
Oh, you're right. You're so smart.
No.
Girl Jaw asks, "Are you nervous?"
I'd be lying if I said I wasn't some percent nervous, but when you've done this a few times, you kind of have some idea what to expect. So I think just knowing what's involved has, of course, I'm kind of in a little bit of a privileged spot, not having to be nervous about that aspect of things. How it's going to happen. Really, the main thing I'm nervous about right now is that I'm recovering from an upper respiratory illness, so I'm just hoping that my sort of need for throat clearing and coughing isn't going to be too disruptive to the actual procedure. So just heads up, I might need to raise my hand at times to try to, catch my breath or swallow, or that kind of stuff. Customary things of that nature. I think that's pretty much it. But otherwise, no, for the actual procedure, not nervous about the procedural aspect of it. I'm kind of a little bit more, I think, the thing that we've learned to be a little bit more, watchful for is really the healing of the palate after those, mid-palatal incisions and corticotomies. So, just curious to see how that's going to be. I think it's more the experiential stuff that comes after it. Really kind of getting in there with the water pick and blasting food particles out of there. Sometimes in these, more robust FME models, we've just got to be really good about our home care cleaning underneath the device and so forth. So it's really mostly the aftermath, and I guess I'm, of course, this is a talking heavy job that we do. So and I haven't had any time sort of erased from my schedule this week. I'm seeing patients tomorrow at 2 o'clock. So I just hope that I don't. Maybe I'm just going to try to be somewhat more. I'll have to practice brevity with my words this week because I tend to, be able to talk a lot. So.
How many millimeters are you thinking of expanding?
As many as God wills. I think. No, for real. I mean, I'm not going to predetermine any limitations. I'm going to do what needs to be done for clinical benefit, and whatever is aesthetically tolerable. I'm kind of an expansion maximalist for myself, just because I kind of know what I need, and especially because I'm pursuing protraction. I tend to be of the belief that protraction, one of the things that will facilitate protraction is larger, not expansion. So that's why I'm just going to kind of navigate that way for myself. And I've got, good doctors of different disciplines all around the country that'll help me put this back together if I get a little too ambitious.
Someone did mention, we'll forgive you if you talk funny.
Yeah, buddy.
The next question is, how are you going to protract?
So I'm probably going to be one of the early users of Phasegenics's FME system. That's their sort of protraction, kind of suite, if you will. between sort of the body gear and the protraction wire that hooks onto the FME. You guys will probably get a chance to see what what an FME capable of protraction looks like. It looks very similar to an FME not capable of protraction, but it has little holes in it that allow the protraction wire, which will be a removable apparatus to hook into it to then allow the patient to protract.
Roja asks, how is that different than the reverse pull headgear / face mask?
It's basically the same concept. You have an extra oral anchor outside in front of you, and you're basically using some kind of system or mechanism to pull it. Traditionally, we use some kind of chin and cup mask or neck brace mask or body brace mask and pull with rubber bands. And then this FaceGenix protraction system is going to have kind of a spring-loaded sort of box cartridge type of thing that will be the force applicator, if you will, between the extraoral apparatus and the intraoral apparatus, right? And then those things will be married together with this force applicator. So again, I'm not 100% sure about when that is going to be available to me to try, but I'm going to just start with expansion. It's going to take me a little while, I think, to get enough expansion. And then, deeper into my expansion, hopefully we'll start pulling on that top jaw a little bit.
Crush asks, can more protraction be achieved with this new headgear?
We have reason to believe that it can. We have seen some of the thought and research that has gone behind, the application of vectors of force involved with protraction, and how your bone anchor unit, your FME, is going to respond to it. And at least, of course, these are all somewhat in vitro types of models. This hasn't, what I mean? But I think that level of study has, to my knowledge, never really been done with development of a protraction apparatus. So big shout out to FaceGenix for actually really putting so much thought and study into this. We have reason to believe that larger amounts of force application will require lesser amounts of time to yield the same net effects. So we hope that also the practicality of it and potential compliance will be higher. Of course, it's only going to be as effective as it is, comfortable enough to do and practical enough to do.
I think face mask is really meant for more for kids, and also sometimes there's a risk with pulling the teeth forward rather than the bones. Is that?
So with this, there's not going to be any teeth involved in anything. This is going to be, because it hooks right onto a bone anchored, expander, and then it wraps around the dental arch without touching the dental arch. So you're basically just pulling on the bone, so there shouldn't really be any dental effects other than any natural decompensation for those who have very compensated dentitions. And so face mask is traditionally done for younger individuals, but now with the advent of bone anchored expansion, if you get adequate sutural disarticulation in the cranium, then essentially we biologically start to mimic what happens in youth with traditional expansion. So that is the wave that we're trying to ride, so to speak, and that's what I'm going to try to do.
Okay. How will you deal with the mandible after expanding?
I will reevaluate that once we see how much I can afford to expand. That's a whole topic in and of itself, I think, beyond the scope of this discussion. So I will keep people updated on my thoughts on that as we progress through expansion. But yeah, that is a loaded question. I think I'm, of course, my default thinking is, just standard orthodontic decompensation, and if that needs a little more muscle, whether it's in the form of, grafting or some kind of lower distraction or whatever, we'll, scratch that itch when we get there, so to speak. But, for now, we'll just try to kind of keep it as simple as possible. Very good. So yeah, that's pretty much it. And then I guess I'd, maybe see what if Dr. Jafari
It's a
has
good
any.
take ibuprofen, why
Yeah.
you take it before so that you can mitigate some of the pain.
Yeah, buddy. All right.
Okay. All right, one more question.
Yeah, good.
One more.
Good, 30 seconds.
Invisalign or braces after?
Probably Invisalign. I think it's just going to be a bit more practical in my case, and I do have some crowns and other things, so I think we'll start with Invisalign, but if needed for achieving any particular mechanics that we're looking for to set up the bite, I can flip flop pretty easily. I have no aversion to wearing braces for this process if that becomes necessary.
You can give him another after he's rinsing. Rinse for about a minute.
And you guys can kind of hover around the camera just so, from time to time, capture a little bit of the whole experience of the room. All right. Yeah. So you can, occasionally take your sort of filming equipment, move it around a little bit, you know what I'm saying, so.
Alright. Wanna put some numbing jelly?
Yeah, buddy. Let's freaking go, man.
He's ready.
Mm-hmm.
You put your own filling there the other day?
All right.
Dr. NEWAZ'S did his own filling.
Mm-mm.
Oh, no?
It's just
Oh, Verna did it?
blue.
Alright, perfect. We're gonna take care of that afterwards.
Temporary. Blue bonding.
I see. Gives it character.
Someone says maybe it's smarter not to watch if you're planning to have one in the future.
Yeah. We're gonna do a post-game analysis too.
Mm-hmm.
So if you are, fighting the blood, then go ahead and turn it off, and then.
Yeah.
And what I meant by this is no fear, not don't watch it. But of course, if you get a little bit, uneasy around medical procedure kind of stuff, then obviously don't watch it. But I don't think anything inherent about the procedure, should be too intimidating or whatnot. But of course, it's easy for me to say, right?
Denver and Jacksonville on the beach right now.
Mm-hmm. Mm-hmm.
Taking the chin off.
How would you take it?
The chin.
NEWAZ'S looks like a rock star. Of course he
I'm
does.
gonna breathe like a rock star.
He is gonna breathe like a rock star. So currently we're numbing. All the questions, yeah. Pre-industrial maxilla, here we come. I like that.
Can't see much from
Okay, right
the
here.
light.
Because of the light.
Yeah, I think of the light.
My light?
No, no, overhead.
You can wear on. You can.
This feels like a scene out of the Matrix or something. It really does.
Yeah. Anything else?
I mean, Dr. Locke is the Morpheus, you know?
The boss. The boss again is FME done. How's that feel? Good?
Yeah, bud.
Switch around. Do you need to rinse again?
Nah, that should be good.
Oh yeah, we're actually installing the Neuralink, not the MSC.
Yeah, buddy.
Yeah, but
Hey, come.
Oh, good.
You feel right?
Dr. Watt, someone said you look like Morpheus.
You right? You okay? You right?
This is not the first adult FME.
Now we're gonna try in the first guide. You wanna make a promise?
Yeah, we're gonna have to make a shirt that says "Yeah, buddy."
How's that feel? When we're working, just make sure it's all the way seated at all times.
Okay.
Not just like in a normal guys. We already secured the body into the guide. We torqued it down to 40 Newton centimeters. Trying this out too. Good. Body, look at that. Holy crap.
My mom has one of them too.
Okay. When we take this out, it's going to be a challenge to be clear, right? It going nice and numb?
Yeah, buddy.
Okay, I'm going to give you numbing throughout the process too. Alright. Take the blade, we're going to make incision. Yeah, this is okay.
You can come behind me too. You can see a lot.
Yeah.
Okay.
Oh, that's way better. Are we gonna do the piezo cut today?
Yeah, you doing that?
Okay.
You ready for that right now? You anything?
You felt that?
You feel that?
Oh.
Action.
Dr. Fari, would you be able to walk us through what you're doing?
Yeah, we're taking the blade now and cutting the metallical suture area.
So you guys probably saw how my jaw jumped a little bit. That's just my TMJ kind of issues. So, you know, every once in a while I see me try to kind of adjust it in and out of place.
Okay, now we're gonna start making the cut. If you do anything, let me know, okay?
Christina says that it already looks pretty big, the palette.
We're gonna get bigger.
We need,
We had,
yeah,
we
bigger.
had 3 molars taken out when we were younger. Both of us did. And so now we're gonna make up for some lost space.
Do we have the current measurement for the palate? I don't know.
No, that's not making it. Okay. This is the Action Piezo cuts the bone very efficiently. Want to make sure there's a lot of saline to keep everything cool. You go to the TNS.
I get too close.
You know how we look on the survey?
That's pretty good.
So I kind of flush it out. You good, bro? Just gonna let it go. Okay?
That's too far. So
You
there's
get
no
a-
guide for the piezo cut.
Initially there was. We found that it's very hard to utilize and to get a nice deep cut. So we kind of go freehand at this point. But initially we had that, but it didn't work out too well. So now we do a freehand. We're going to the floor of the nose at this point. Hey, John. Cool. We let the instrument do its job, and go a little bit slower, stick with enough saline, keeping the bloom cool. And as I'm going, I can feel that we're hitting the floor of the nose. Feel okay? You feel anything? We're getting close to the nasal palatine for Raymond. Okay? I'm going to the detail. I'm gonna switch it quick. feel anything? Alright.
All right.
Nice and
Yeah, everyone thinks it's really painful.
he's not feeling anything.
What's that?
Did you feel anything?
Nah.
Nothing. Okay.
We make sure that the patient doesn't feel anything, because that's vastly important. Okay, now we're gonna put the surgical glue. Just grab, just put the saliva duster down. Just make sure it doesn't dribble down in the back. Open doors.
If you guys have any questions to Dr. Jafari, please feel free to ask.
Open doors. Just put that in.
Dr. Jafari, do you usually do the piezo?
Yeah. An open door.
That's yes.
So we're a tag team, you know, we, depending on the case, the patient,
Dr. Noaz, how are you feeling? Oh yeah.
Comes up. Yeah, clean the back, okay. Open doors.
Yeah, buddy.
Mm-hmm.
Can you fill this up?
So now we're gluing the
Now we're gluing the
The cup.
piezo cut.
piezo cut. Okay.
So we'll activate the FME today, and we'll give him a couple days for that cut to heal. We find that making sure the soft tissue healing is very important. Okay.
Will the cut reopen when you're expanding?
So we wait a few days before expanding, because we want the cut to really heal. Just look at your foot.
How long after the installation do you wait to turn?
We'll turn immediately. Let's kind of like to activate it. And then we'll wait 4 or 5 days.
4 or 5 days. Okay.
Just take a look. And I'll put the
looking gnarly.
pilot. How are you feeling so far?
Good.
Dr. Noaz, do you have any trouble with the gag reflex when this is happening?
No.
Nothing. Okay. Clean cut, yes, P.
Jeez,
I
look
love
at-
that.
They got a nice haircut yesterday too.
Oh, yeah.
Yeah,
Now I'm gonna be putting
Yeah,
the guy back
Yeah,
in.
what?
Yeah, Pete.
Yeah, buddy.
PNG say yeah, P.
Oh yeah.
Yeah.
So I like to make the patient super duper numb. So kind of going through the guide holes and make sure the patient's very numb. Doing okay? Good.
Daniel GW asks, is FME much more expensive than MRP?
Yeah, open big. The cost of development and it's been passed on to the consumer, so yes.
Rinse me out real quick.
Come on again?
Ah.
Yeah, you can start. Let me move the candles then. Okay, so now we're gonna be using the lance drill to kind of go through the soft tissue. If you anything in the okay? You kind of go through the soft tissue.
Is that a cord economy? TNT is asking.
This is going through the soft tissue for now. We call it the lance drill.
How many screws are we doing today?
We're doing 10 feet. Open. So 10 pads and then protraction.
Okay.
Good, okay.
Dr. Nawaz is stoic right now.
Now this goes through the cortical layer of the bone. Open it. Make sure it's seated all the way. Open it. Visible first. Open big. Open it bigger. Open it bigger. Open big, I'll give you a bit. So oftentimes some of the hardest part is actually the patient opening.
Oh, I'm gonna change to exactly the body.
So what are you feeling? How does it feel? Is
Oh,
it
it feels good.
vibrating?
So it's changing out the saline bag.
So Christina L is asking, is the plastic thing guiding where the screws go?
Absolutely. So this is guiding the pilot holes, and then it in turn will guide the screws and the tabs.
All right. Okay.
Open here. Give it a break.
You don't risk breaking the guide.
The guide is very sturdy.
Okay.
Yeah. These are the same type of guides in terms of the plastic that we use for implant placement as well. So very sturdy section.
Is there, Girl Jaw asks, is there any possibility of hitting the roots of the front teeth?
Oh no, this is right in the center. This is the FME is bone born right in the center. So no real risk. We've already tightened their body down to 40 centimeters.
You want to show the mouth?
Where's-
No? Open? See the little holes?
Tiny little holes.
That really do.
Can I see?
You probably don't want to see that because.
I thought you wanted to.
Okay. So now we've already pre-sterilized all of our TADs. The TADs there's a map of the TADs in the back where we've already predetermined the sizes and the length. So these are 11.5. The middle 6 screws are 11.5.
Oh, yeah.
Girl Jaw asks,
Swallow it sometimes.
so the way FME is designed to install is so that the screws never puncture through the nose?
They also sometimes go bicortically. Now we're starting the screwing process. Okay.
Mm-hmm.
Okay. Put this in real quick. Okay.
This?
Yeah. Open. If anything falls, spit it out. Okay. Open. Big, big, big.
That's looking good. TNT's, bro, this is actually insane. I never thought I'd be watching a live stream of NEWAZ'S getting an FME. That's so true.
He's the people's orthodontist for a reason.
Yeah.
You okay, Dr. Rose?
Uh-huh. Yeah, what?
Can you get another glove? Glove? Right there.
Oh.
Open there.
You're a small or medium?
Extra
Open.
small.
Open big, big, big. Open. There's always on that.
So Dr. Nawaz, do you think the screws are the most peaceful process of this whole process so far? Okay.
Dr. Rose, are you
I
feeling
think so
anything right
too.
now? Open big. Big, big, big. Open a little bit more.
It's like very hot.
My hair hurts too much.
A little more. Open. One more. A little more. Yeah. Give me a small.
Christina L asks, what if you can't hold your mouth open that long?
We give patients a break. Yeah.
Oh,
This one.
that's one.
Any feedback, Dr. Nawaz?
Pretty good. Oh yeah, yeah, buddy. Did you feel any pain so far? Nothing.
So the septicane that we give diffuses through the bone really well, and so usually our patients don't feel anything. Maybe sometimes when the really long pads go in towards the end, but usually most patients don't feel anything.
Joe Hags goes, Dr. Noel taking the plunge. Now you know how it feels. Oh yeah.
So now we're gonna actually hand tighten the tads to 40 Newton centimeters. Then we'll take off the guide. Let me take that off. There's the first section. Okay.
You spilled this is asking, how deep is the piezo assist? Lower cortical only or straight through?
Straight through.
Straight
For
through.
the most part. Open through. So you hear that click? That's 40. 40.
And you just had MSC or?
Yeah, I did.
So now we're gonna unscrew the body. I hope it goes back in. Okay. Anything falls out, spit it out, okay? Mm-hmm.
Joe Hags goes, I couldn't pass up the chance to see Dr. Z begin the ascension.
Oh, yeah.
Open book. And he's gonna give us updates throughout the process. Open book. So now we go through these back lines that we marked to take off the guide. Open book. Can you get that mirror? Mirror.
want me to wipe it?
It's like not a good mirror.
Open big.
Can you wipe this one? Okay. Do we put it anywhere?
Okay.
Dr. Nawaz, Jaw Hacks is reminiscing about when you put his MSc in 2019.
Is that Ronnie?
Yeah.
Hey, Ronnie. Open big.
We've come full circle, yeah, honestly.
You can open a little bit. And now we're gonna try to dig it out. This section.
Moment of truth.
Take these out.
Oh, yeah.
This is gonna push them through.
How does it feel
Yep.
in your mouth?
Good, excellent.
Can we see
Different?
it?
So,
Yeah.
Let's see. Whoa.
can show them that real quick. Or to show real quick. So everyone is done. So everyone is gonna be taking out the screws and putting them back in. This section.
Do you still have yours like in? Or
No, I have it all out.
Yeah.
Yeah.
How long did
Yeah.
you have it?
Oof. Yeah, Dr. Nawaz.
How long did he have his?
Well, that's a loaded question. We're gonna save that for maybe a podcast.
Oh gosh.
Yeah.
I'm gonna try them out.
It was a journey.
Oh, it's a journey.
And it fits like a glove.
Perfect.
Okay. So now we're gonna tighten the screws. Can you try to clean this one, right? Clean these here. Put this back in.
Jaw Hack says looks good, cyborg.
See. Could adjust that. Making it up.
Oh, that's a good question. Danielle GW asks, what factors led to Dr. Nawaz opting for FME over a custom MARPI?
What is it?
That'll be better outside of the chair.
Once
I-
we're done.
Okay.
So keep that question in the back of your mind, or re-ask that when he's done, and then that's a good question though.
Jaw Hacks goes, let's get a diastema before signing off. We'll answer that question after.
Dispose of it?
Open
Yeah.
big.
Yeah, the sharp's under the sink in there.
Christina is asking, is this essentially the same process for a MARPI?
Yeah, pretty much. The MARPI we cement onto the teeth. We do have to prepare the teeth a little bit, and then clean up a little bit of excess. Cement, we check the bite a little bit. But just once it's in, it's pretty much there's no.
I did that so many times.
There's pros and cons to both MSc or MARPI and FMEs, so there's a time and place for each one of them.
You spilled this is asking, can you put another expansion module if the first one maxes out?
Yes.
Yes. Jaw Hacks is asking advantages of FME over custom RP. That's a good question.
And Dr. Ross can kind of go into that a little bit later when he's done. So we have 2 questions to the table.
Okay.
Section. So that click means that it got to the right torque value. So I've already pre-labeled after sterilization. So these are the back 2.
TNT is asking, do all the screws have the same torque requirements?
They do.
Okay.
All the screws do. Let's keep that yeah, number 7. I'm putting the last one to open this again.
Crush is asking, when does the FME max out? At how many millimeters?
I'm almost done. You can answer that once I'm done with this one. Good.
7, 9, or 11, depending on the series and the palatal anatomy within which it can fit.
What's yours at?
I actually don't know. But if
Yours is a
you
2A
see
one.
the
Yours is a 2A.
2A,
Yeah.
it's 9.
9 millimeter.
Open this one. So these are self-threading pads, nice and sturdy.
Dr. Nawaz is joining the live feed.
Yeah.
This is very typical for our patients these days.
Sorry, guys. Alright, 3.228 9 millimeter. Yeah.
All right. Double check. All right, 9 millimeters. Typical streamer, gotta tune into the chat.
Last screw.
You Spilled This is asking, is NEWAZ'S joining the face mask gang? Well, yes, but first it has to be expanded, right? And then,
Regular.
Vampire?
Yeah.
Piotr Szczyński is asking, how did Dr. NEWAZ decide how much he wants to expand? What's the process of figuring it out?
To be determined.
To be determined.
Yeah, based
Okay.
off of, his clinical need, aesthetics, things like that. Okay, with this?
Wow.
Whoa. That was the last screw.
All right. Section.
Mercutio Murphy is asking, do you have a narrow palate, or are you just doing this for fun?
Somewhat partially, somewhat, of course. Well, yeah, I'm just trying to optimize certain things about my own anatomy, but also, I've always liked to understand, kind of what my patients are feeling and doing stuff. So that's part of it too. And yeah, part of it's for fun. That's why I'm not, being super predetermined with the expansion amount. I kind of want to see what I can get and go from there. But I kind of want to, try to go for a lot here.
Do you want to become Dr. Zubad Chad NEWAZ?
I would love it.
So we're gonna do a one turn right now. Okay, open nice and big. All right, one turn. There we go.
Ron is saying he
Yeah,
can't
what?
continue to be mocked by his wife, who has a perfect jaw.
Well, I'm never gonna get that perfect. Check out that rule Bangladesh.
How'd you feel that? Did you feel anything?
Nah.
You want to just do one more?
Do one more.
Yeah, we're gonna do one more.
All right, let's go.
Let's go.
Can't get a good angle.
Feel that?
Yeah, buddy.
All right, here we go.
We gotta get some more.
Coming up. Whoa.
Yeah.
Yeah,
buddy.
buddy.
You're done.
Oh yeah.
You want to go
All right.
ahead and do some?
Now we're gonna do some
Let's
questions.
get your glasses off.
Yeah.
And,
Yeah, buddy.
the big-
No, I actually look cool, aesthetic. All right. How are the feelings?
Let's go sit
Yeah,
down.
feelings were great.
Let's sit.
Probably gonna suck in like a little bit, but it feels great right now.
All right, let's take a
Have
seat.
a seat and then we'll have some interesting questions.
All right.
Just over there.
Yeah.
There you go. Look at that.
Right here. Wait, let me. So I stabilize the camera. All right. Now we can do a post-interview, post-surgical interview.
Well,
He was so excited to get out of the chair. How do you feel?
I feel great. I mean, it feels like a little bit of a mouthful right now.
So most patients do undergo that kind of like,
There's gonna be adaptation period.
and that adaptation is usually less than a week, I'd say.
Mhm.
Obviously, if you're a singer or, podcaster or something like that, like it's a little bit more difficult.
Y'all gonna take it easy on my virtual consultation schedule this week? Maybe all my consultation schedule. Let me just see recurring patients this week. Or tell the new patients records only, and that, you know, the conversations won't have to happen later on. Right.
It's
That
okay.
might be-
We'll give them a couple days off. Some of our patients are like,
Yeah, we'll do all
we have, like,
two-step-
singers.
two-step consults.
Yeah.
For now.
some of our patients are like
Nice
singers or opera singers. You know, this definitely is not for you at this time. Yeah. Questions?
So, Dr. Nawaz, how does it feel with the tongue?
Yeah, I mean, it feels like something new's there, but you know, it feels okay. I mean, it feels like how I'd expect having something drilled up there to feel.
Okay.
Yeah.
Girl Jaw says, welcome to the Expander
Smooth.
Club, Dr. Nawaz.
Yeah, buddy.
How was that, Dr. Nawaz? Easier than the SRP?
No, Serpy.
SRP. Sorry.
I've never had a SARPI, so I wouldn't know. I would probably think so. SARPI is a hell of a lot more invasive than what was just done. Yeah, I think for me, really, I mean, the procedure was all very comfortable and easy. So Dr. Defari did a fantastic job. You know, Dr. Defari is, you know, I think he's very, you know, invested in getting the patient comfortable and all that. Yeah, for me, just because I'm a little congested, you know, I just had to find whatever I could to breathe and swallow during the procedure and all that.
He's a great patient, by the way.
Good suction and all that, right? You know, so. Yeah, and I mean, you know, actually, patient, I mean, let's talk about this just real quick. You know, I think patient behavior is something that I think is, you know, I'm opening up a subject here that I don't know, this isn't necessarily the forum for it. But, you know, I think a lot of these things are taught, you know, I think, you know, we see with a lot of our, you know, parents and kids and stuff like that, you see certain behavior patterns. You see some kids just hop in the chair, they're sitting on their hands, they're not squirming around, you know, these things can be taught. You know, I think there's a certain amount of hardiness missing from, you know, some, you know, just the way that we can be in today's day and age and generation. So, I mean, I think part of what has made me a good patient is just that that's kind of how I was expected to be when I was younger.
Yeah, absolutely.
You know, I think that's important. I think we see a lot of downstream effects when people don't get that kind of training. And that's okay. We can work with you.
And we do.
But we want to, you know, be your doctors in more sense than just doing procedures on you. You know, we want to help you get stronger, you know, mentally and all that through the work that we do together. And again, you know, patient attitudes have a lot to do with outcomes.
100%.
You know, if you think you're go into something thinking you're gonna fail and experience a lot of problems, you know, papers suggest that you're probably gonna experience a little more complications than the next person, right? And so, you know, I think these things are important. You know, obviously, you know, of course, it makes our life easier to say that, but when our life is easier, I think what we're shy to say sometimes is that we do a better job, right? We're spending a lot of energy, I think, diffusing tensions and anxieties, and then we can't actually invest as much thought and emotion into, you know, completing a patient's case, you know, getting them better if we're always managing behavior and anxiety.
In practicality speaking, the quicker a procedure is, the less pain, less swelling, less you have to keep your mouth open. So I think that in today's age, and we've seen this evolution, you know, we've been practicing for, I graduated almost 15 years ago now. You know, patients these days are literally on their phones the entire time. And so that actually decreases the speed, and which could increase possible complications. So, you know, I know that, you know, that's pretty common for us to like scroll and do Instagram and whatever else and check the Discord and stuff like that, but that actually slows down the whole process and could possibly even create complications or issues with healing in terms of timing. for something that you could literally just wait 30 minutes. What were the two questions that we wanted to circle back on?
Yeah, we have a lot of questions.
Oh.
So first, we're gonna ask, what have you learned from this procedure, and what are you gonna start doing differently to your patients in the future? Or is this too early to tell?
It may be a bit too early to tell. I think, yeah, not being shy with the numbing though is a big part of it. I mean, I was very fortunate not to really feel anything today, but what I can tell, you know, having been a bit congested, you can see me kind of trying to manage that whole situation. And just to kind of have the opportunity to swallow, breathe, all that kind of stuff. I think I'll probably, you know, pay a little more attention to that, you know, patients needing breaks and other things like that. I know my jaw kind of pops around a little bit, so things of that nature, sometimes the amount that we have to open to reach certain areas.
We have
you know,
different
try to be
sizes
as
too.
considerate as we can, but
Yeah, we definitely, I know that we're both super particular about making sure our patients are numb. The last tabs that we usually put in are the longest. So sometimes we'll go back in and make sure the before we put those last two tabs will numb again. Because getting numb at the second cortical plate is a little more difficult. And then also the anesthetic we use does diffuse through the bone pretty well. You know, one question that we had before was, do we have a guide for the piezo cut? Initially, we used to, and it didn't really work out too well. So our feedback with Phasegenics was pretty much that's not really, it wasn't practical. What else?
well, I think there was a question
then-
while we were in
yes.
the custom mark, the FME.
Yes, why FME over custom RP?
Well, sorry, I'm just trying to collect my. Well, you know, I think, you know, in my case, I just kind of wanted to try it. You know, try the FME. I thought I was pretty much ready to do a MARPE. You know, as well.
Did you start one before?
Well, no, that was just the MSE I pulled out of the box. No, I mean, and I would go either way, honestly, myself, just because I see what each system can do, and I think for what I need, you know, any kind of skeletal expansion, any kind of real estate gain, you know, I'll be okay with. So you know, we figured we do this, you know, and again, I'm excited to kind of see what, you know, we can get out of it. Of course, there's what we call the B series, so that was talked about when we were doing our installation. The B series refers to when you max out the first expander module on an FME. This was one of the reasons I chose it, was because there's the possibility, at least in development right now, is what's called the B series, which is you can screw on another expander module without taking out the whole, you know, expander, and so forth. So, you know, I thought that was, you know, that was good. And, you know, I kind of know that, I mean, obviously occupationally, I have to talk a lot. So I think the smaller footprint of an FME was one of the reasons I went with it. You know, it's
Protraction.
definitely got a smaller footprint, and the protractor was a huge one. I think the capability of protraction with what we know to be the principles behind the FMA, I think that capability is going to be on a level of its own. So I'm all about that. I mean, most of you see me, you know, I'm kind of one of those people that looks tired all the time. Part of it is anatomic, right? And part of it's real, because I don't really sleep a lot. But part of it is, you know, yeah, this part, you know, I kind of, now, you know, and sometimes, I mean, people of our ethnicity too maybe tend to have a little bit of, you know, this type of, you know, kind of thing. So I think for me, it's really all three. I think it's my own sleep habits. I think it's anatomic, and I think it's ethnic. But you know, that's one area where if there can be some correction, that would be fantastic.
Okay.
Some of the benefits of the MSC is they're super customizable. So some people that have extremely narrow palates or asymmetries, we can sometimes you correct their asymmetry, so Dr. Nawaz does a great job of planning to kind of compensate for a patient's existing asymmetry. Yeah. Next.
When can you eat? When can you eat?
Well, I can do it right now. I'm probably gonna kind of go on more of a NutriBullet type of deal right now. Might be an opportunity to get some more micronutrients, some of the greens.
It's an AG1.
So I might do that. And the big motivation for me to do this is accelerated weight loss. So so I don't really care when I can eat again or not, but any soft foods as long as you clean stuff out. But I think
We made sure he was well fed all weekend.
That's good.
We need to get a water pick for you.
yes.
Water picking is probably the most important thing in terms of cleanliness for the FME.
Mm-hmm.
The FME, before it actually expands, it's actually a little challenging to keep clean versus like sometimes the MARPy maybe a little easier to clean.
So, how will this impact your Yeah Buddy performance?
How will this? Well, if this, I can interpret this question in a number of ways, and I'm hoping my performance improves in a number of ways.
Ooh.
Yeah, buddy.
Yeah, buddy.
So I'm not sure exactly what's being asked, but I hope all around, performance-wise, this is beneficial. More oxygen. Again, I'm hoping that we have all kinds of other gains. Of course, most of us, males in our late 30s, we may be experiencing declines in endocrine-related issues, mental health kind of stuff. You get some of that back, no problem, right?
Yeah, well,
Yeah, I mean, I'm young at heart, but to get maybe young and
Vibrant.
structure and function again, that would be fantastic.
All right. So when is Dr. Jafari getting?
I'd say in the next year.
Oh, you trying?
Yeah, try to. Because I mean, okay, so a point that he made was I've been always saying for, probably don't need it. And it's something that he said is you don't even know how life would be if you had better breathing. So when I started thinking about it, like, I probably have a deviated septum. I've been complaining about that since I was a little kid. What if I got a little bit of oxygen, a little more oxygen? So maybe within the next year, probably.
Okay. Perfect. So your jaws turned out pretty well, and you had premolar extractions, correct? Would you want to talk about that?
Or did the jaws turn out pretty
Or-
well?
yeah.
After the premolar? That's the question.
No, that's so again, this is, I'll get deeper into this, I think, on a dedicated show for it or something, but just got swallowed.
But by the way, it is actually hard to swallow initially right now because he's still numb.
No, yeah, it's mostly the numbness and the post-nasal
Yeah, the
kind of
congestion.
stuff. But, so anyways, as far as the draws, right, not everybody pays the same price for retractive orthodontics. Again, even though I have a lot of the hallmark kind of issues and, it's more about, like, what kind of susceptibility did you have before the premolar extractions? How much worse did it make it, right? Some people get premolar extractions that's basically you're just occupying the space by mesializing back teeth or whatever. I know that I had, kind of a lot of that sort of en masse retraction of the front teeth for overbite and that kind of stuff, right? So I kind of know that my treatment was very retractive. I'm glad that maybe my facial structure doesn't make it very obvious, but if you look at pictures of my airway, now and maybe 30 pounds ago, it's still pretty damn narrow, anterior posteriorly. So I think that, it would have been nice to have more, forward backward real estate, a little more potential for lower jaw growth, right? Because my maxilla, as was sort of shaped through my orthodontic treatment from age 13 to 16, was, undoubtedly the confines within which my mandible was able to grow and position. later teens, I started experiencing some clicking and stuff like that, locking on opening, that type of thing. And so, for me, and then of course, deeper into my 20s, 30s, start kind of experiencing a little bit more, sleep related breathing types of issues. Of course, right now I'm kind of a freight train snorer. So I'm hoping that some of that alleviates a little bit. But no, I mean, again, all that being said, I'm alive and well, right? I got through, pretty much 13 years of school, and did pretty well with other, parts of my life.
Clearly very well.
Despite
Very smart.
all this. I don't know about that, but
One of the smartest people I know.
I got through the system, so to speak. So, and we know that a lot of our patients that kind of have similar challenges anatomically, it really affects performance. So we really try to help them through that. So again, I didn't pay as much of a price, and maybe, on some subconscious level, I developed techniques to cope and compensate for those things. Just knowing about the jaw joint anatomy, kind of helped me do all kinds of this and that and everything else to try to, kind of periodically decompress my own compressed jaw joints, just to, you know what I mean? Almost like informal, momentary treatment, I guess. That plus some other good habits done over a period of time, maybe we can overcome some effects. So it's not like, I also don't want people out there who have maybe had, what we're purporting as, the wrong kind of treatment to feel hopeless, There's a lot of people out there who have no functional airway problems as a result.
Like myself, but I don't think
exactly.
that
So,
we have too much of an issue.
So we don't want to assign, or project any kind of, negative outcome from a certain brand of treatment, even if we don't subscribe to it.
Okay.
Next question.
So a lot of people want to have a turning video.
Okay.
So we're gonna grab a mirror and maybe Dr. Nawaz can
Show.
turn and show.
Oh, they trying to see that?
Yeah.
All right.
So
Y'all want to do it for me, or they want to do it, or they want me to
Can you
do it?
do it?
would you be able to do it?
I can try to do it.
Yeah, it's got a mirror right here.
Y'all put this in a sterilization fountain?
Yeah.
I'll just take it right out. All right.
Oh wait,
So-
hold on.
on it?
Okay.
Am I on it?
Yes, I believe so.
Uh-huh. Mm-hmm.
Mm-hmm.
Yeah, I just brought it back.
Oh yeah.
Because we had 2 in there, right? Yeah, but
Oh yeah. That's good. Is that what you guys wanted? All right. TNT is saying goat.
Absolutely. Go.
nah, not at all though. But again, we're just trying to do our best to solve these types of issues.
We're trying to further the profession.
Yeah.
So is asking. You mentioned clicking. Are you worried expansion can make that worse?
I'm not worried. I'll just manage it some other way. I mean, expansion can momentarily make any TMJ problem better or worse. I don't know how my experience is going to be sometimes as a result of, the occlusion changing and the bite being a little bit wonky. Sometimes we see that, same type of, like that jaw movement or whatever, lack of native bite stability be a source of TMJ distress. Other times we see it as a source of TMJ deprogramming. I frankly don't really care what happens in my case, because I'll have half a dozen tools to fix it, and I can go in the mirror and I can build up my build-ups a little more, whatever. I can make a retainer. I can.
And I mean,
so-
that I think
Yeah.
to highlight that point, because he's an orthodontist that does a lot of TMJ pain treatment, a lot of skeletal, people that have anomalies, he's confident, and we're confident that a patient that has expansion, we can solve any issues that come along with that. And that's the benefit of doing it with us,
Manage,
is,
yeah.
is that we can, obviously expand, place it surgically, then do the orthodontics to close the gap, and then if there are any complications from the jaw joint, we can also manage that. So if we were, and that's one of the advantages of working with us, is you're gonna get that start to finish treatment and aesthetics as well at the end too.
Yep. And, yeah, I mean, in addition to managing it in the moment, there's the overall treatment plan, right? Of course, I have that mandibular entrapment tendency. I'm hoping that a little bit of upper jaw expansion with a natural, at least mild bump out of the maxilla that occurs just from expansion alone, plus, what we might do dentally and bone-borne, protraction-wise, hoping gives me the clearance I need to free myself from the shackles of mandibular entrapment, and go accordingly. So, at least, for me, I just, I kind of have that confidence that this type of treatment is going to at least create a better probability of improving my TMJ condition, although correcting that is going to be a little bit of a dance. It may not be super predictable or easy, but I'll try to be as introspective as possible going through this myself to see what might be of high utility, going forward in my own treatment of the patient.
So Murphy is asking, you had your wisdom teeth extracted?
Yes,
Yes. So you have 24 teeth?
unfortunately.
Okay. Daniel is asking, compare the risk of asymmetry between custom RP and FME.
I think, I think we'll need to see when more data gets in. I think all expansion modalities have a risk of asymmetry. I think FME, because of how protocoled the installation is, I think, there's some asymmetry protection in that. But again, the same sort of level of CT guided planning is done for MARPs, and it's I think when it comes down to the asymmetry question, I think planning is a big part of it, and then also expander behavior during expansion is a big part of it, and then of course differential bone resistance is a part of it. So I think as far as planning and native skull anatomy, I don't necessarily believe that there's much inherent difference there, but as far as device behavior during expansion, we have maybe so far more reason to believe that FME's stability is a bit more protected throughout the expansion process. But let's see how things pan out. I think it's.
Are we looking at the questions?
Oh yeah, we have. So is FME going to widen the smile as much as custom RP?
I mean, I sure kind of hope so. I think, again, absolute amounts of expansion are more important for that question rather than the expansion modality, in my opinion, unless expansion is just very disproportionately sparing of posterior expansion for some reason. But generally in cases where you do have a complete split of, mid-palatal suture, regardless of the, type of expander you use, then it's more a function of the, magnitude of expansion. So I'm kind of going for a lot there. I feel like the corners of my lips just kind of, shrink, and they're just a tiny little mouth. So I'm trying to push it out for sure.
So how long will be the active process of expansion for you?
As long as God wills. I hope that God has mercy on me throughout this process, and that this is a means of me, reflecting on not so good things I've done in my life, and helps me empathize with those who go through pain and suffering. But really, that's yeah, I went on a little tangent there, but basically, again, I have no predetermined sort of rate or amount of expansion. So
Expansion is a dynamic process. It's what's beneficial to the patient, what they can tolerate, and then also what's aesthetically suitable too. So most of our patients, they love their aesthetic outcome as well. So we kind of make sure that there's a lot of dialogue between providers and the patient.
So is asking, what was the biggest surprise for you from early FME results?
I think the biggest surprise was how consistent the results have been. I actually was not necessarily expecting that level of consistency or efficiency with the expansion. So we've been pleasantly surprised. Not that I didn't have some sort of theoretic, faith in it, but to actually see it come to fruition and see